So good afternoon, everyone. It's a real pleasure to be here with you today. For those who don't know me, I'm Yannis Sakadiaris. I'm a computer scientist at the University of Houston, and I serve also as the chair of AI in Healthcare GCC cluster. Before we begin, I want to thank both Suzanne and Don and all the GCC staff for the tremendous work they have done for the cluster. So I'll pass it to you, Suzanne, to tell us a little bit about GCC and the rules of engagement for today.
Thank you, Yanni. Yeah, so welcome everyone. We're really glad you're here. We're excited about this new cluster and lots of enthusiasm among our other research consortia as well. For those of you that don't know, the GCC is a consortia of 7 institutions that since 2001 have paid into our organization to facilitate cross-institutional research and training initiatives. And so we're really excited about this new group. As for today, our first meet and greet, we're going to hear briefly from the few 8 speakers who were able to join us today and just kind of give an introduction of what their expertise is, what kind of special technologies that they have that they can share, and what kind of collaborators they're looking for. You'll have the opportunity to ask questions out loud and in the chat as well. So just kind of as Yanni mentioned, the rules of engagement, the plan is that after we get started, each person will have 3 minutes, and the person moderating the session will give the speakers a 2-minute warning. And that doesn't mean you have 2 minutes left. That means you're at 2 minutes, you have 1 minute left. And then at the 3-minute mark, they'll say, okay, we'll take questions now. And then that will be the time where you've got 2 minutes for questions. However, in the event that there are more questions than can be answered in the 2 minutes, the speakers will be invited to continue answering questions in the chat. So it would be helpful if you, when you write your questions in the chat, if you actually write the name of the person that you have a question for as the first word. For instance, if you have a question for Winston, you put Winston and then your question. It just makes it easier for the speakers to find it. I think that's it. Did I miss anything?
No, thank you, Suzanne. And I want to repeat that basically we have 2 objectives for today. It's our first meet and greet. So our first objective is just to get to know each other and begin this trip to trust, because we need to build the common trust. And I'll be interested to meet each and every one of you here in the call and those that couldn't make it. So we have, I see 22 participants. That's wonderful. I'm really pleased, and I want to hear from everyone. And the second is, I want to help, all of us want to help us connect with the incredible talent that we have here in the Gulf Coast area in general. And we'll talk about partnerships between healthcare personnel, computer scientists, and data scientists. Before I continue, I want also to invite Professor Devika Subramanian from Rice University to extend her welcome too, and I'll share my screen in preparation of the talk. Devika, the virtual microphone is for you.
All righty. I'll keep this real short because I can't wait to meet all of you. My name's Devika Subramanian. I'm a computer scientist at Rice University, specializing in AI and machine learning. Really thrilled to be at this part of this meet and greet. And looking forward to hearing from each one of you. So our first speaker today will be Yanni, because he's projecting his slides, and the rest of you, we have your slides, and so we'll project them for you, as Suzanne explained. So without further ado, Yanni, the floor is yours.
Hey, can I jump in real quick? I just forgot to mention we are recording. So if you have your camera on, you may end up in the recording. But anyway, that's it. Turning it back to you, Yanni.
All righty.
Thank you, Devika. I appreciate it. So actually, as Devika said, I serve as the chair, but all the kudos goes to Devika and Anathana Pragada, who currently couldn't be with us today, but he serves as a co-chair. And this is a coalition, I will say, of individuals. We have about 100 participants from all 7 institutions here in the Gulf Coast area And you may recognize the representatives of your institution here at the steering committee listing. Feel free to reach out to them. Feel free to reach to any of us. We're here to serve you. So I think there are two words in our name that deserve no explanation, but allow me to tell you why we think they need to go together. So those of you who are in healthcare, you know about the triple aim: increasing population health and the experience of care, of course, decreasing the per capita cost. You are familiar that this triple aim has been recently enhanced to be the quintuple aim, to address the health and care inequalities, and at the same time increase the well-being and engagement for the workforce. I think this is a very important aim that we really want to keep in mind. Now, for the word AI, you know that AI is not new, and don't ask me to define AI here because there are so many definitions, but I think we can all agree with the definition given by McCarthy back in the 50s. But AI has really blossomed, and the methodologies that we see around us are definitely new. So I will not spend time to tell you why AI in healthcare or why AI in medicine in general. I just want to tell you why we thought we need to have a cluster here in the Gulf Coast area. And I think this came from the realization that we have incredible talent, but we are not as coordinated, and we want to create teams that are multidisciplinary and interdisciplinary. And the first question that actually Suzanne posed to us is, why a cluster do you think will be a better thing to be a multi-institutional effort rather than a single institutional effort? And the way we approach this subject is that we view the cluster as an environment, an ecosystem that fosters community of practice in the area of AI in healthcare, AI in medicine. And it has both research activities and educational activities. Education is very important, and workforce development for that matter. And in terms of research, there is foundational research in AI, but also there is use-inspired research. These examples that I have here in this slide, they are just that, they are examples. What we'll do in the cluster depends on you, the participants. So we're looking forward to your active involvement and driving the cluster. So the next thing is, as Suzanne mentioned, GCC has a number of clusters, and this is where the power comes, because if you see the names of the clusters here, you will see a great diversity in terms of the things that our community cares and the wealth of expertise that we have. And
One minute, Yanni.
I just show that there is a lot of natural synergies. I just did cut and paste of all the titles that have the word AI and potential synergies. So I think it's important to have our goals, understand what are the gaps, and then understand what is our role in the team. And what we want to create is a research that is more than the sum. We want to have 1 + 1 = 4. So I will skip this because you can see it later. But for me, a cluster is for us to be able to see around the corner. And the key takeaways, we want our stack disciplines to collaborate, and we want to build an ecosystem that includes both healthcare personnel, computer scientists, and data scientists. And for that, I thank you.
Great. We have time for a question. Okay, if not, we should move to Dr. Chen then, and there'll be questions later on.
Okay, a small change. I think we thought that since I have the controls, I'll continue presenting. Chen, with your permission, if you don't mind, I'll continue a little bit about me, and then you will have you as a first speaker. This is out of necessity rather than anything else, and we apologize. So I'll just tell you a little bit about me, and it's natural and not to have questions, I understand, but please reach out. We want to hear. So as I said, Yanis Kadiaris, and what I want to bring to your attention is, if you want to put a label, put me on the label of computer scientist, data scientist, in a sense. And I'm very interested to contribute to diagnostic, predictive, and prescriptive analytics. And the first one means more of a root cause analysis. Predictive analysis means we have a lot of historical data, what the trends and patterns in, and prescriptive is you have a lot of options. What's the best way to do something like that? So I'm very interested to prediction of risk, outcome, or survival using structured or unstructured data. One thing that I feel very passionate is the idea of multi-layer graph networks. We can have different sources of information and contribute to making a prediction. We don't have enough data. Those of you in healthcare, you understand that not one institution has enough data. How we can do privacy preserving learning using data from multiple organizations, and how can we build trust between our teams? So explainability and understanding what the AI model is doing is very important. But also, I think it's important to understand that you guys are holding the domain expertise. You hold the biological expertise. So how we can bring a partnership between humans and AI in this case. I've done a lot in identity and affective computing. And the unique resources that I want to bring to your attention, you may not know, but UFH recently acquired a system with 10,000 CPU cores and 327,000 GPU cores. So please take advantage. And we have every year a very interesting cohort of people that they are interested to do research in the intersection of AI and healthcare. So in terms of what I can contribute, as I said, I'm a computer scientist, but I'm interested to see how the social determinants of health play a role. With COVID-19, we know there are a lot of counterfeits and illicit networks. So I invite you to think how we can bring our expertise in this. And I think one of the strengths is that I'm very interested to understand the pains and gains of you, the collaborators. I have highlighted here some of the areas that I have worked in the past, so you can see some selected contributions, and deal with the fact that we can use machine learning and game theory for the prediction of adverse events. We have pioneered ways to analyze images to extract information that will help the physicians understand better what is the next best action. And in terms of identity and affective state, we have contributed in the ways of understanding it of individual and even in the presence of facial masks. And with that, I'll stop here and I'll take your questions. Devika, back to you.
All right. Thank you, Yanni. Now our next speaker will be Dr. Chen from the Baylor College of Medicine. So if Don, you could queue up his slide and I'll start your timer. Ah, there we are. As soon as you begin speaking.
Hey, great. Yeah, I see actually next. Okay, cool. So hi everyone. It's nice to have opportunity to talk to you guys, and then thanks for Divya and for introduce me. So my name's Chen. I'm at Baylor College of Medicine. So I'm currently the director of the Center for Single Cell Omics at the college, and also director for the two cores, the single cell genomic core, and the recently founded the separate epigenomic core. So that means we produce a lot of data for other people in addition to ourselves. So my lab research are primarily interested in genetics and then genomics underlying the neurodegenerative disease, particularly in the vision system. So we also are currently working on large projects like human and mouse retina cell atlas. We're really interested in single cell technologies and also high throughput functional assays and screens. So the strengths we have is, of course, we have produced a lot of data, very heterogeneous data. So that I think that's really, how to say, can be mined and can be elevated to next level by combined with AI and the machine learning and other technology. And my current strengths, where I'm really familiar with human genetics, mouse models, single cells, and bioinformatics. So the collaborator, I'm really open-minded. I already collaborating with quite a few groups, including Dr. Chen going to present later today. So we, the work I see that can benefit from a lot of collaboration or more collaboration is, say, how to annotate the book of life, how to integrate the heterogeneous data sets, and then how about how to interpret high throughput functional assay, and then the single cell multi-omics data integration. So next slide.
Okay, 1 minute.
Yeah, so just a few, data set we have generating. It's just a picture versus 1,000 word, just so you can see. We have already generated and continue generating a lot of single cell omics data, RNA and tag, and then epigenetics. We have a lot of experience in the mouse and human, histology and medical, mutation. So just. And then also we start working with Dr. Chen in the last few years, so looking for medical images. Because the eye system, you can have a lot of alignment images. And of course, we have been generating next generation sequencing type of data for the last 15 years. Next slide. Yeah, and recently we also try to combine the RNA and the taxic data with the spatial high throughput, like microscope imaging data. And then I think there's a lot of opportunity there and to really develop some, cutting edge software, and so we can have comprehensive cell type identification and spatial map and temporal resolved, basically single cell resolution. I think that's it for me. Thank you.
Thank you very much. Any questions for Dr. Chen?
Allow me to remind everyone, because we don't have the raise hand feature and we cannot see all of you, just jump in, correct? I mean, let's not take it personally.
Yes,
so,
yes.
Dr. Chen, I'll start, and my worry is how I can build this matrix of fundamental research and use inspired research. So if you were to take a crack, what is one fundamental AI research that you would like to see, and one use inspired domain that you would like to see? And warning, I'll be asking this every speaker, so we can build a matrix by the end of the meeting.
Yeah, I think there's many opportunities. The one, some of them where I'm already collaborating with, say, Dr. Chen with the medical imaging aspect, right? How do you start image and transform to matrix and then to connect with, human genetics? But I think one area that is missing here is the multi-omics data integration, the single cell data, which is a very high dimension, very noisy, and how can you put the totally different data set together in a more coherent way so that you can understand the biology behind it? I think there's a lot of things to be done, for example.
Thank you.
Yeah, that's inspiring. Great. So I think we can try to stick to schedule and invite our third speaker, Dr. Winston Leong from the University of Houston. Great.
Hey everyone.
Hello.
My name is Winston Leong. I'm a family doctor, health services researcher, and chair of health systems and population health sciences at the University of Houston College of Medicine. My research interests are in using artificial intelligence for prediction and integrating electronic health records and geospatial analyses and assessing and addressing social determinants of health in clinical settings. A lot of unique resources are clinical sites. So I have partnerships with Lone Star Circle of Care, which is a community health center, HCA, Humana, which is a national payer, and the American Academy of Family Physicians and American Board of Family Medicine, which are national organizations. Next slide. I can contribute expertise in social determinants of health. We're currently finishing a randomized controlled trial on medical legal partnerships, which is putting lawyers into clinics to address health harming legal needs. and expertise in electronic health records and the delivery of primary care. I'd love to find collaborators from the cluster to help me use artificial intelligence to enhance clinician-patient relationships and improve the effectiveness, efficiency, and equity of primary care. And I think there's a big need for using clinical trials to evaluate artificial intelligence tools. Next slide. So I'm here to recruit you to help me improve the delivery of primary care. Primary care is where most people get their care. Nearly half of all visits in the US are to primary care, but primary care is drowning in data and reporting requirements, which are eroding the time that physicians have to develop relationships with patients. And I think this is really where AI can help, and I'll provide a couple of examples. Chatbots can facilitate patients getting the right care at the right time at the right place using the right technology. This can improve the quality of care delivered so that physicians can spend more time developing relationships with patients rather than ordering tests. In this example, the chatbot is reminding patients that they are due for preventive services. They can provide education to help them make decisions. They can generate referrals and schedule appointments. I also think that AI has the potential to enhance the effectiveness of the care that we deliver by harnessing data within the electronic health records. Here we're just looking at a map of Houston. Depending on where you live, the life expectancy variation is about 23 years. So where you live has a huge impact on your health, and yet this type of data is not typically integrated into prediction tools. And so that's something that Ioannis and I are trying to work on, is developing prediction tools that integrate social determinants of health data, community data, claims data into enhancing the performance of those tools. Over the past year, Dr. Kakadiaris and I have written a couple of commentaries together where we talk about the creation of AI teams consisting of AI researchers and primary care researchers. And so for primary care to thrive, we really need to recruit talent, such as people who are on this call. So I'm happy to take any questions, and also happy to tell you more about primary care and recruit you to help us improve the delivery of primary care.
Yeah, thank you. Very interesting. Any questions? Maybe we have time for just one. And we can queue up Dr. Petit from Baylor College of Medicine, Don, while we do that.
Since no one jumps in, I want to thank Professor Liao for his really leadership on bringing AI and primary care together. And I want to stress that in the teams that we are building, I don't believe a single computer scientist or a single primary care delivery person is adequate. We want to build larger teams. So the fact that he and I collaborate, we are just the seedlings. If you want to join us, please join us. That's the point that I want to.
Yeah, that's true. We need an army of people.
Thank you.
True. Particularly if you want to do clinical trials, then you need the army sort of both on the intellectual side as well as sort of on the boots on the ground to get it done. So very exciting project indeed. So we'll keep on schedule so far. So Dr. Petit, I invite you to tell us about yourself and the things you work on.
Sure, thank you so much. I'm very honored to have the opportunity to introduce myself at this meet and greet. I'm actually still a graduate student. I'm an MD PhD candidate at Baylor College of Medicine. That am working on artificial intelligence and my lab work and clinical projects. My first interest is in machine learning to create clinical assistance tools. Probably most notably, we just received funding from the NSF to work on a clinician assistance tool that will help in liver transplantation, specifically in trying to optimize the organ match process between persons on the wait list and donor organs that are being offered. I am also interested in combining genotype level data with phenotype level data for patients to try to create optimized predictions of lifetime risk for disease development. Currently, I'm working on that for granulomatosis with polyangiitis, and for lung cancer. Kind of more broadly, I work in a population genetics lab. Several of you may be familiar with Dr. Chris Amos. I am his graduate student, and we're doing genome-wide association meta-analysis to try to determine associations and then ultimately risk for disease development, particularly in lung cancer. Next slide. So unique resources. I'm a student, so I thought about putting time, kind of unadulterated time, as a resource that I could offer. But I'm affiliated with Baylor College of Medicine and have developed several connections both in the clinical world as a medical student, as well as throughout the graduate school. I have proficiency in Python, R, and Linux, and could offer that to the cluster. And I have supervised and unsupervised machine learning experience, most notably with, most tangibly with supervised, as I'll show you in a minute. And then what I'd be looking for in collaborators would just be areas such as epic record extraction. I would like to be able to move into that arena, as well as how to appropriately conduct feature selection on genotype level data, which has many, many different features available. Next slide, please. So one project that I'm working on, and this is the one that we have NSF funding for, is to optimize survival predictions before liver transplantation to try to create the best donor organ reception match. And to keep it short, here's our visual abstract. We took all liver transplantations that have occurred in the United States since 1987 and compared machine learning methods to accurately predict outcomes. Ultimately, we found random forest had appreciable clinical utility. At 1 month, it could predict who would survive with an AUC of 0.8, and at 5 years, we were able to still predict who would survive after liver transplantation with an AUC of 0.73, with a clinical utility of about 0.7. We thought that was appropriate. And so we're hoping to expand that into an actual clinical decisions tool that could provide quantifiable data to surgeons in real time. So would be happy to collaborate. If any of this was interesting to you, please let me know. My email is on the slides. So thank you for this opportunity to present at this meet and greet.
Thank you. We have time for one question.
Please, I'll hold off myself. I will not ask my question, but I want to encourage Roland to spread the word about the cluster and encourage more students to become part of the cluster and attend our activities, because we really care for training and professional development of individuals like you, Roland. So thank you for joining us today.
Thank you.
Great. Actually, let me echo that, Roland. I think students have time, which I think is a not advertised loud enough. All of these problems are hard and require real investment of energy and effort. And since you are in the biology field, you already have a lot of the biological background. So, you are a unique resource. So tell your friends, as Yanis just said.
I will. Thank you.
So we are 1 minute from 1:30. So I think since we started 5 minutes later, I feel we're doing good. Should we then move on to, well, now it's Yanis's turn. So I'm going to hand the baton over to Yanni. And you can queue up our speakers, Yanni.
Thank you, Devika. So one of the things that we would like to learn from you, I know that many of us suffer from acute Zoomiasis, correct? Zoom for this, Zoom for that. The question is how we can increase the interaction. So feel free to either voice your ideas here or send us an email, because in different times we'll have a meet and greet, maybe after 5 o'clock for obvious reasons. But right now we are kind of stuck with this medium of collaboration. How can we make it work for us to meet and greet and have a debate, correct? I mean, we want to be, how should I say, provocative. let's debate about something. So anyway, that's my 2 cents. I want to invite Professor Storch to tell us a little bit about him and what he's interested. Eric?
All right, great to see you again. So I'm a clinical psychologist and vice chair and professor in psychiatry at Baylor. So clinically, we've been working in a bunch of different areas across psychiatric populations and modalities, including various aspects of neuromodulation, neuroethics, and we've moved into affective computing and digital phenotyping. On a positive, Wednesday, I got an 8th percentile in my R01 in this space, where we're looking at how do we kind of look at, various vocal linguistic elements and facial action units to really understand various aspects of psychopathology across populations. And so what I'm really looking for is to try to partner with someone with that expertise and then really dovetail it with the clinical expertise and interventional stuff that we've been doing for way too long. On the resources and then kind of bringing it to the table, I think the resources we have is an untapped clinical population and a wealth of ideas for how we bring in engineering concepts to really enhance the field of psychiatry from an assessment standpoint to an interventional standpoint. Next slide, please. That's a big part to it. 3 years ago, I moved here. I never thought I got an R01 in neuroethics, which I never thought I'd have an R01 in neuroethics. And so, in addition to kind of the phenotyping and interventional piece, this is sort of the other piece that we bring to the table. A point raised right at the beginning by Ionis is, NIH has funding for this. And I think there's a lot of enthusiasm in it. I think there's a lot of enthusiasm for behavioral health as well, and really kind of figuring out how we can bring technology to enhance the field is relevant. Next slide, please. So this speaks a little bit to some of the work we've been using with open source. We had a supplement to a large UH3 that was focused on deep brain stimulation. And the whole challenge in psychiatry is we basically ask people how they feel. And they might lie to us, or they might be terrible reporters, or any host of problems. And so what we want to do is really objectively monitor different kind of facets. So for example, if we use, Z-face, can we, map on to facial action units and really look at individuals' kind of affect in response to a trigger. There are a few slides I have where we did this with someone who had OCD and deep brain stimulation when it was turned on and turned off. And you could see it on a qualitative level, but you couldn't really measure it if it was just a clinician and the patient. But now we have this way of really tracking their affect. Now, of course, psychiatric measures are like, how depressed have you felt over the last week? And so we want to get at something much more subtle and also be able to kind of, touch those patients that may not be able to report because they have an IQ of 50 and aren't verbal. So we want to think about all of this across the way to have a more nuanced, less error characterized measure of assessment, but also we have thoughts on how we can improve intervention as well.
Yeah.
All right. Thank you.
Thank you, Eric. It's remarkable that we don't have to interrupt any one of you. So you're basically under the time. So thank you, Eric. But we do want to stimulate discussion. So we have time for one question, maybe for Eric. Just jump in.
So I really like this project of yours, Eric. It reminds me of something I did many years ago, trying to understand how people learn complicated concepts. Mm-hmm. And just like you, verbal articulation of how they're doing the learning, particularly the ones who fail to learn a task, are practically useless. So I'm completely on board with you on being able to find quantifiable metrics that look at things like, ultimately we ended up tracking the eyes. Mm-hmm. And then taking EEG data by looking at their brain activity and which parts of their brain were active, and tapping motor activity from their hands, and fusing all of them to form a quantifiable index of of learning. So I would be, interested in looking at how, I'm also looking now at aphasia and Alzheimer's, ways of detecting them from like behavior data. So this would be, I'd be very interested in learning more about your problem and seeing how I could help. I'm a machine learning person, so this would be something that would excite me tremendously.
Fantastic. Well, I will reach out and
Please do.
hold the meeting.
Yeah.
All right, so Devika, you're next.
Oh, darn. Okay. All righty. Ooh. Hi. Okay, my name's Devika Subramanian. I'm a professor at Rice University. I've been here for, I hate to say this, almost a quarter century. My interests are diverse. I'm a problem solver at heart. So this means I get excited by problems for me. And then I like to innovate in the method space to help solve those problems, because it's rarely the case that something off the shelf works for anything that I'm interested in. So I can give you a brief sense of the things I've done. Right now, my current projects are in pharmacovigilance, and I'm developing actually algorithms for learning from unlabeled data for the AI people in the audience. And that means developing embeddings of representations of drugs and side effects to be able to predict side effects before they get reported. Also, drug-drug interaction, this is a huge problem, and echoing Yanni's interest in graph convolutional networks, a new technique for modeling complex interactions. This also speaks to the multi-omics data integration. So if you want to really integrate data from multiple levels of a phenomena and make sense of it all, this is a possible framework. Like Winston, I'm very, very interested in EHRs and what we can do with all the data that lies trapped there. So combining labeled data with unlabeled data, I think is going to be very important. How do we predict diagnostic error? So actually I have a funded NIH grant, both in the pharmacovigilance area as well as in the predicting diagnostic error area. Where, if physicians label some records in the EHR as containing error, can we go out and get others that are similar in order to flag more errors? Currently, I'm working with the TCH, Texas Children's People, for predicting diabetic ketoacidosis in type 1 diabetes just from their EHR data. So my other sort of different interest is actually in understanding opinions from Twitter. So I've built algorithms for detecting bots in social media data. Having a great time with that project right now because Twitter is in fact overrun by bots, and getting opinion on all manners of things, from medical facts to political opinions, and so forth. So I'm very, very interested in broadening participation and training clinicians in the use of ML. I think that's really where the advances will happen, when we invite people in the clinical area to get comfortable with our methods, so they become confident in using it themselves. And I think that's how we'll get the AI into the clinic. So that is a passion of mine. So I can help in building these pipelines, AI ML pipelines for a variety of data sets. And I already see opportunities to work with so many of you. Next slide, please. So this is just more details about the things that I can do. I also have experience in running boot camps in AI and machine learning, and I'm more than happy to work with clinical and biomedical people to help get them comfortable with AI and machine learning. The things I would like to get from the cluster is, as I said, I'm a problem solver at heart, so problems, particularly involving large amounts of data from multiple perspectives or multiple levels that need to be combined in order to understand a complex phenomenon of interest. So, I welcome both individual and group collaborations with clinicians, with scientists, very open-minded. I'm a former electrical engineer, so I really I'm very broad-minded about the types of problems that I like. I haven't met a problem I don't like yet. So I'll stop there.
Thank you, Devika. And I think we are all here to enhance our networks, correct? To get to know other people and interact and debate. So questions for Devika? please turn on your microphone and speak. I cannot see all of you in my screen. That's one of the challenges of Zoom.
Yeah.
So what is the most difficult problem that you have encountered in your collaborations, Devika? And I don't mean the problem in terms
the technical problem, yeah.
I don't mean the technical problem. What's the difficulty in forming these multidisciplinary partnerships?
I think it's the time you need to take to understand the other discipline. Data is not just a bunch of numbers. You really have to understand what is underlying that. So I can give lots of stories, not right now, obviously, about how sometimes it's taken me, almost a year to understand the true nature of a data set before we could actually analyze it. So I think patience is needed if you want to build a long-lasting collaboration, and an open-mindedness to learn the other person's area and concerns.
So I think this reminds me of a slide that I saw recently with one arrow pointing to the solution and another arrow pointing to the problem. So I think our attitude here is not trying to force down on you different solutions. We're trying to understand the problems and the holes that we can help you with our expertise, and we're trying to see how many people are needed to understand the holes and then connect you with the people. As you notice, there are different subgroups here collaborating, but this doesn't mean that they have to be exclusive. We want you to reach out to us and say, I need a partner in this. Whom do you recommend? So this is one of the functions of the cluster, that we want to be the brokers that will be able to point you to different individuals. So please reach out. So
do we have time for one more question, or should I hold on?
No,
okay.
Hi.
Yeah. Hi, I'm Ramasa. I'm a retina specialist, and I do already collaborate with a few people in the group. I have a career development award in kind of intersecting AI and medicine and understanding how we can apply AI to healthcare problems, specifically retinal disease and screening. So I thought, Devika, it was really interesting that you mentioned training clinicians in machine learning and AI. And I have been trying to find helpful resources as a clinician to really understand the basics of machine learning and AI. And I feel like it's not that easy. The courses are not really geared towards clinicians. They're more geared towards computer scientists. So I wanted to hear what your thoughts are about that, and if maybe we can talk offline about
I think we should talk offline. Brilliant question. I may have a few leads for you to help you.
Okay,
but there is no pat answer. I can't give you one in like, here's HTTP, blah, blah, blah.
I will reach out to you.
Yeah, sure. Please reach out.
But that's definitely one of the objectives of the cluster, how we can bring AI even in the medical school curriculum, if possible, in the specialties afterwards, in the residency, fellowships, so on and so forth. So Ramasa, please reach out to Devika. We really want your input on how we can develop this area for professional development.
Thank you.
So thank you, Ramasa. So Ashok, are you ready?
I'm ready, but maybe I will be the first non-conformist here and request Yanis, do you mind letting me share screen? I prefer to use a slightly different set of slides that would be better suited for the purpose.
So I have no problem. I'm asking Dawn because she has the keys to the kingdom to give you this permission.
I think the permission is already there. So if you like, technically it's okay.
Yeah. We wanted to share time to save time. So as long as you stay on your time, we're good.
You can see my screen?
We can.
Okay, so rather than just talk about my narrow research interests, I think that we're a group of about 10 faculty now in what we ourselves call Scalable Health Lab. And our goal is to work on these three axes: biobehavior, bioimaging, and bioelectronics. I myself personally, Ashok Veeraraghavan, faculty in electrical and computer engineering, and I work on the bioimaging side of this. It's a group of faculty, as you can see, some of us electrical engineers, Ashu, myself, and Tayun, and Akane here. a couple of us from Rice Psychology, Chris Pagundes and Margaret, and from Baylor Psychiatry, we have Nidal as well. And it's a growing group. We are inclusive. We are looking for new collaborators to join our mission, and we are thinking about problems in the intersection of biology and personalized electronics / imaging devices. What can we do in terms of solving hard clinical problems using new novel digital technologies? As far as our bioimaging capabilities, which is the stuff that I represent, I work on design of computational cameras. So if you have a hard imaging problem that in a clinical context is difficult to execute, that's the kind of problems that I work on, building small micro and nano cameras for wearable and implantable microscopes, cameras that can see through skin, perfusion imaging. So you have a biomarker that you want to image, and you want to image this biomarker in a non-invasive setting. So camera-based heart rate monitoring, heart rate variability, pulse transit time, or blood pressure monitoring, these kinds of things. We also have in the past worked on projects like retinal imaging, on the in situ retinal imaging that go as applications on your smartphone. And part of our team also works on machine learning for health and medicine. Primarily, our focus has been on cancer and diabetes related problems in this context. And so there've been a few projects that we've worked on in this context as well. I'm just going to expand on each of those three pillars for a slide. So here is an example of a technology that we worked on.
You're at 2.5 minutes, Ashok. 2.5 minutes.
Thank you. So here's a technology that we worked on, small cameras that can be implanted, embedded for applications like endoscopy. Another interest of us is using cameras to get biomarkers with a non-invasive, non-contact technology. So here you have just normal webcam videos being converted into heart rate variability, and actually PPG waveforms directly. And finally, we've been working on image analysis and machine learning algorithms for histology, radiology, and immunochemistry as well, primarily focused on cancer. But obviously, these technologies are generally broad and can be applied for other domains of interest as well. And while I'm presenting it, as I mentioned, much of the work is joined with many of the faculty that I mentioned earlier. That's it.
Thank you, Ashok. I appreciate the fact that you presented so many slides in such a short period of time. So any questions for Ashok? So maybe Ashok, you can share the old slides and answer the questions, because the structure of the slides was intended to facilitate collaboration.
Sure. So in the main thing that I probably didn't talk about in this is what's the expertise that you seek from the cluster. And as was obvious from my presentation, I'm a technologist and engineer. So as any other engineer, I solve problems. In the absence of problems, I'm useless. So bring me your problems.
So then I will to invite everyone to advertise the cluster to people that have problems, because obviously, as it's evident from this call, we have a lot of problem solvers, but we don't have enough holes. So we invite you to bring to the table people that they have problems, and they can share their expertise and their holes, and we'll try to help them as a group. So thank you, Ashok. I really appreciate that. And we need everybody's help to attract more people in this cluster. So thank you for what you're doing. So
thank you, Yanis.
You're next.
Oh, take me.
Sorry. Hi everyone. I'm Degui. I'm from UT Health. I'm at the SBMI School for Biomedical Informatics. I think here also several of my colleagues are also in the call. So we are a group of biomedical informaticians. I see biomedical informatician is somewhere in between hardcore computer scientists in the group, and also those clinical people or biologists. We are designed. This profession is designed to be very interdisciplinary. We are like what I see is kind of glue to bring people together. We understand the problem a little bit faster, better than computer science, but we don't have that like most sophisticated high expertise on algorithm. And then so I'd like to collaborate with all sort of people, be it methodologists, technologists, or clinicians, because I see the connection. I see how to match the problem with expertise. On myself, I work on already several deep learning projects. I work on latest. I work on structured EHR data. We build a predictive models for that. We have several papers on that, and I think it will be interesting. We use second-hand data, but it will be interesting to be deploy or like make this happening into the first-hand data, right? That would be most useful. And as Ray mentioned, we're also working on deep learning phenotyping of imaging data, in particular retina data and also brain imaging data. And we use unsupervised method primarily, but it doesn't really matter. I think we learn a representation from imaging such that it's more amenable for genetic studies. So it's sort of not traditional, but something new. That's what I see AI is to bring something in the middle of the disciplines. That is a new thing, that new concept, and that makes it really interesting. And also, I mean, I come from bioinformatics background, and I know DNA sequences and epigenetic, but I'm just too busy to put together better model. I love to collaborate on that. Can I move? Oh, sorry. Unique resources. I have. I think unique to this group, I developed a course called Deep Learning for Biomedical Informatics. That's one of the earliest course in the medical center, and I attract students from all over the medical center, including Baylor, and Roland is currently enrolled in my class. He's one of fantastic students so far. Can I move on to the next slide? So what I can contribute is, like I said, I can connect really people together, and if for the clinicians or biologists, I serve as a methodologist, but for computer science, I translate the problem into something that may be better to be solved by computer scientists. So I love collaborate with all sorts of people. And I'm looking for students and looking for GPU resources because I see like so many connections that not enough bandwidth in between. I want to like make that happening. Do I have a third slide? Okay, yeah, those are some selected paper from my group. I'll stop here, leave a slide here. Maybe I can take questions if I have any.
Mm-hmm.
Thank you, Dengui. So any questions for Dengui? So then, if there are no questions, allow me to indulge me for a few minutes, since we'll end this call soon. And one of the things that it seems that we accomplished today is to form our first subgroup. Those of you that are interested for AI education in the medical field, either for students or physicians, please send an email to Devika, and she will formulate this as a subgroup. and then we will be able to see how we can help as a cluster. The cluster does have a website, and it will be emailed to you afterwards with more information, where you will see these slides also posted. And with that, if you have any comments, please open your microphone and your camera as you wish.
Just on behalf of all of us, I should just say thank you to both Yanis and Devika for organizing this and making this happen, and for trying to get us all together to form a cluster here.
Thank you, Asek. And I think I speak for both Devika and I that our payment will be to have increased participation in the next meet and greet. Just because you presented today doesn't mean that we don't want you to participate in the next meet and greet. We want to have a vibrant community. So please if you liked what you saw today, please advertise the events to the participants. Suzanne will send a new invitation for the next one. I think it's happening in November, early November, if I'm not mistaken. So please encourage people. If you are interested to join the cluster, it's a very simple process. Email me at ioannisk@uh.edu, and I'll be able to send you the information. And with that, Devika, any parting thoughts?
So I think I would like to, first of all, thank everybody who spoke today. You know, you have to take time out of your day to come do this, and Yanni and I are truly appreciative. But we would also like to get ideas for other events we can do through the medium of this cluster. For example, would a special workshop of some kind focused on a particular topic interest you? Would a lecture series interest you? I mean, just give us ideas for ways in which we can bring people together in ways, you know, so that we can all get inspired to do the things, not only the things we do, but more things. So anyway, I'll stop there.
Hello, can you hear me?
Yes, I can hear you.
Hi, great, thank you. My name is Larry Driver. I'm a professor in the Department of Pain Medicine at MD Anderson. I just opened up Zoom on a new phone, and so please forgive my San Francisco Golden Gate background there. It must be the default. But I am astonished at the presentations here and the opportunities. As mentioned, I'm professor of the Department of Pain Medicine. I'm also a professor of clinical ethics, and I have been for the past 5 years the chair of the Texas Health and Human Services Commission Palliative Care Advisory Council. There's a group of stakeholders and experts from around Texas who meet regularly to advise the governor and the legislature and the Health and Human Services Commission about various issues surrounding palliative care. And I am just fascinated by some of the potential opportunities for clinical applications of AI, engaging some of the expertise that was presented here today. I think that we can look at areas of pain and symptom management and appropriate evaluation of patient and decision making around those areas. I think end-of-life care can be improved using AI strategies. And then also as an ethicist, I'm just thinking about some of the potential opportunities for ethical decision making on a proactive basis using AI data that can inform future clinical care in an ethical context. So this has been fascinating. Thank you for doing this. And I know this has been recorded. How is that going to be available to us, the recording?
So I'll react a little bit to your comments, Larry, if I may. I think we have a second subgroup. Those of you interested to join the concepts that Larry mentioned, feel free to email me and I'll connect everyone here because he mentioned some very interesting problems. Yeah. And I'll let Suzanne, in closing, I'll pass the microphone, the virtual microphone to Suzanne, and she will tell us how this recording will be available, how the slides will be available, and when is the next meeting. Suzanne?
So we're going to have to kind of reevaluate the next meeting, but it will get back. We're going to send an email out with a link to where these resources will be uploaded. We still are waiting on media releases from some of the speakers. So for those of you who gave talks today, it would be great if you could get those back to me, because that'll be the biggest holdup on getting the slides out. So if you haven't gotten that back to me, please get that back. But we'll have an email going out to all of you by the end of the week that'll have a link where you can find the resources and update on when we'll do this again next month. I've also taken down all of the comments from the chat, just so you know. Those will be passed along with all of your emails that wanted to be part of the conversation to Yanni and Devika.
Mm-hmm.
So thank you very much, everyone. Stay tuned. Watch your email, and looking forward to see the number of participants double for the next time. Thank you all. I appreciate it.
Thanks, Yanni.
Bye.
Yeah. Thank
Bye.
you, everyone. Bye.